as per usual, we won't be able to give you detailed information on those cases until tomorrow to allow ourselves the time to investigate them. I'll walk through verbally a bit more information than I usually do about the individual cases because we don't have the summary up for you to view. But if you imagine being able to see them all, we've got people between the ages of their 20s through to their 90s. One individual in their 20s, one in their 30s, the rest in their 60s, 80s, or 90s. The locations are all in Simcoe, Muskoka, except for one individual, a woman in her 60s from Gravenhurst. There are no individuals that have been hospitalized. They're all recovering either in their home or in the Bradford Valley senior home, of which we have an additional 5 residents from that facility added to the list. And I would also say that that 4 of the cases were acquired through travel, and 2 were acquired in the community, and 2 were close contacts of other cases. And then I'd already indicated that 5 are part of the outbreak that's happening at Bradford Valley. I think I'll walk through some additional information with regards to the 2 senior home outbreaks. There are no additional reported cases for Spencer House, so all we've had to date is the 1 staff person who was working well transmissible. And so far to date, none of the individuals, staff, or residents that have been tested at that facility have been found to be positive for COVID. And with regard to Bradford Valley, as I'd indicated, we have an additional 5 residents that have tested to be positive. That makes a total of 14 residents that have tested positive, as well as an additional staff member, so that's two staff. The additional staff members among the additional 6 cases that have come in since 5 o'clock last night, and thus I'd be able to give more information tomorrow about that individual along with the other 6 that I've already cited. None of the cases associated with Bradford Valley have had to be hospitalized. They've been relatively mild to date, which of course is a very good thing. Just looking to some key messages that I want to give. As always, I emphasize the importance of community transmission, of people assuming that it's transmitting in their community, that therefore they need to be taking the precautions of physical distancing, 2 meters away from other individuals, avoiding crowds, hand washing frequently, thinking carefully about whether or not you really need to go out, limiting the number of times that you go out. Some additional information I would give or emphasize right now is that people should probably be planning about their outings and minimizing them. So people need to go out to shop for food, or they need to go out to buy medications. They should plan around doing that as few times as they can manage in order to reduce the number of exposures or potential exposures that they could have when they're going out. Those who are above the age of 70, the Chief Medical Officer of Health of the province has advised that they self-isolate at home and arrange for other people to do these things for them, to do their shopping for them if at all possible. And there are services available on 211 to potentially help them, or they could draw upon assistance of family and friends to do so, provided that they maintain the 2-meter distance. Anybody that's developed any symptoms of respiratory illness or mild illness should assume that they've got it, put themselves into self-isolation for a 14-day period, monitor themselves, and seek medical attention if they develop severe symptoms such as shortness of breath. Or if they're a healthcare worker, they should be seeking testing before returning to work and be off a minimum of 14 days regardless. Just a few other key points that I would have. I do feel it's important, of course, for people to take care of your mental health and your physical health, and these restrictions that we've placed to prevent the spread of this virus, to flatten the curve, are hard on people. And so I would suggest that you need to be reaching out with distance technology to stay in touch with friends and family, and think about how you would exercise. Exercise is a reason to go out, but you do need to be practicing that physical distancing. And you probably need to think about your route now, because many places have been closed to public access as part of the response to COVID-19. Just a few things. We talked yesterday about masks. I emphasized the importance of safeguarding for healthcare workers access to masks that are used in healthcare environments. So that would be surgical masks and procedure masks and N95 masks. They're all critically important for healthcare workers to have at this time when we have a shortage. The province is seeking to procure more masks, and there was a shipment that was allowed in from the United States, which is very good, of N95 masks. And the province is now looking to healthcare facilities to be conserving masks and to be saving discarded masks for repurposing purposes, re-sterilization and use. So that is something that's underway to avoid a complete loss of masks. And I did talk yesterday about cloth masks. There was the identification of new recommendations from Theresa Tam, the Chief Public Health Officer of Canada, who stated that homemade cloth masks could be used by people who, when they are out and seeking to do social distancing, find they're in an environment where it's difficult to do so. And thus, wearing a cloth mask might help prevent transmission to another person. So if you wear a cloth mask, it helps prevent you from giving somebody else COVID-19. It may be that you have minimal or no symptoms. It's possible to have this infection without symptoms, and so you could still be infectious to other people even though you don't have symptoms. And if you wear this kind of a mask, it can help protect them from you giving it to them. So that is something that people could consider. Dr. Tam didn't say that it was actually a recommendation. It was merely an option for people at this time. But that would be no substitute for people exercising physical distancing. And right back to the importance of people keeping a 2-meter distance and avoiding crowds and hand washing. And one of the downsides of wearing a mask is that you might inadvertently contaminate your hands by handling the mask, and you could actually give yourself an infection by touching then your eyes or touching surfaces that could lead to infection for other people. So it's definitely not a strong recommendation for people to be using homemade masks at this time. We've also had questions about the use of gloves. So for example, it's been reported that people or food handlers who are delivering food, such as home delivery pizza, the delivery person might be wearing gloves. And that would be absolutely no substitute for hand washing. If you wear gloves, you are impeded from washing your hands, and people tend not to wear the gloves, they tend not to clean the gloves. You should really, I would suggest you don't use gloves at all. In fact, you should just be repeatedly washing your hands, whether or not you're a food service provider or anyone else in the community. That's a really good way to help reduce transmission to other people from you and to protect yourself from transmission as well. Better to dispense with the gloves if it's out in the community and wash your hands frequently. This is not to be confused with healthcare workers in a healthcare environment when they are wearing the full personal protective equipment, when working directly with patients who have COVID-19. In those instances, they do need a gown and gloves as well as mask and eye protection. Just looking down my list here of other things. There was a question here about people in a nursing home wing that's tested positive for COVID-19, and should the staff on the wing be issued N95 masks. So healthcare workers can be using N95 masks or surgical masks or procedure masks, depending on the situation that they're dealing with. For most encounters with patients with COVID-19, they really need a surgical mask or a procedure mask. This is a disease, it's what we call droplet transmitted, aerosol droplets that can settle out within 1 or at most 2 meters from the patient. And for most patient encounters, those masks are sufficient. N95 masks are more protective, but they are really reserved for airborne infectious diseases. So there's some diseases that transmit farther into the air and remain suspended in the air much longer. They're called airborne infectious diseases, and measles would be a good example of that. And for those diseases, you need a higher effectiveness mask, the N95 mask, that does a better, more thorough job of filtering out the air. And so that mask should be used when providing certain type of care to COVID-19 positive patients. If you're providing, or healthcare workers are providing care that results in exposure to the airway and a coughing from the airway, for example, putting in an endotracheal tube to put them on a ventilator, or doing resuscitation to try and revive them and bring them back to life with heavy chest compressions or airway management, then there's much greater potential for the providers of the care to get exposed to respiratory droplets from the patient, so they need an N95 mask under those conditions. So I guess that's a long answer to your question, but the short answer would be almost always for those staff working in say a long-term care facility or nursing home with an outbreak, they don't need the N95 mask. They do need a surgical mask or a procedure mask. Now, there's another question here that's related to that, and it says, should staff in retirement homes be wearing masks as a precaution to protect their residents? And in fact, we from the Simcoe Muskoka District Health Unit have cited some recommendations that have come from the Ontario Health Agency a couple of weeks ago that recommend what we call universal masking, which is the use of masks, surgical masks or procedure masks, by staff in all the time that they're working in a healthcare setting. So throughout the day, throughout their shift, when they're working in a healthcare setting, that they wear a mask all the time, with the exception of if they've gone for a break and are away from the care environment and they're having lunch. But other than that, wearing a mask all the time. And that is because of asymptomatic infections, or infections that can occur with transmission from people who don't have symptoms. We know now that that can happen with this disease. And so to protect both the patients or the residents, if it's a long-term care facility, and also to provide some protection to healthcare workers we're recommending should be wearing a mask throughout their work shift. We do realize that there's a shortage of masks now, and that complicates the picture of being able to do that. We are familiar with mask conserving practices in healthcare settings that can try and deal with both challenges, the protection with the wearing of the mask, but reducing the number of masks that are used per staff member per day. So wearing the same mask throughout the shift, or wearing up to 2 masks per shift, can help achieve both ends of protecting everybody while conserving masks. So at this point, I just want to make sure that I've covered everything. Okay, I think I've covered my bases. So at this point, I'd be happy to take any questions.
Okay, let's start with Mandy. Do you have a question, Mandy?
Hi there. I have a question about the hospitalized cases, Dr. Gardner. You said, I believe you said all of these new ones, none of them have been hospitalized.
That's true.
Do you have any updates on the people who were hospitalized or are still currently?
So we've got, so far of those who have been hospitalized, 2 have recovered, 5 have deceased, 7 are in the intensive care unit, and 5 are in a hospital but not in the intensive care unit.
And what hospitals are they at right now? I don't need specific one by one, just list the hospitals.
Okay. Let me just work my way through my database. They are, or they have been, and well, even at this time, at this point in time, are at Soldiers Memorial Hospital, RVH, South Lake Regional Health Center, Muskoka Algonquin Hospital Corporation, and Stevenson Memorial Hospital.
Awesome. And one last follow-up question. There is a doctor at Stevenson Memorial Hospital, Dr. Kabusi, who has taken it upon himself to build these intubation tubes. I'm wondering if you've heard of them and if any of them have been put into hospitals here.
I'm afraid I don't have any information about that. That would be new for me. But I thank you for that.
Thank you. Okay. James Bowler, do you have a question?
Yep. Hi there. First of all, just wanted to confirm, I think I heard this correctly, but I just want to make sure. Did you say there was only one case in Muskoka and it was a Gravenhurst woman in her 60s?
Yes, out of the new cases.
Fantastic. My other question is to do with you were mentioning gloves, especially in food service, and I noticed a couple of times, food service personnel wearing gloves, taking money, and then also giving the food out. And I'm just wondering if there's any kind of education opportunity here from the health unit or how you guys might police this, because it seems like a bit of a cross-contamination issue.
I agree. I personally don't think it's a good practice at all with using gloves in that environment in that way. It'd be far better that they not use gloves and frequently wash their hands. I think we'll take it under advisement to look at the potential to raise awareness in businesses about that at this time. It's certainly an important time to raise this matter.
Thank you.
Nathan Schubert, do you have a question?
Yes, good afternoon. I just wanted to talk a bit more about not really using gloves. So is there really any situation where gloves could be seen as beneficial compared to hand washing, or not really?
So in the healthcare environment, providing care for one patient who has an infectious disease that's transmissible, part of the personal protective equipment includes gloves. It's used for that care of that patient, and then as part of moving on to the care of others, all of that personal protective equipment is carefully removed, and then the hands are washed and it's disposed of. So that gives you a good idea, I think, as to what is a helpful use of gloves, are used for one instance of care in a healthcare environment of a patient in a very careful way. So beyond that, use for infection control in the community, it probably isn't helpful because it's tended to use much more than just for one instance of a service with one individual. It's not as though they're changing their gloves with every instance of service provision. I think it would be much better if in fact they didn't wear them and they washed their hands frequently instead.
Thank you.
You're welcome.
Do you have a follow-up question, Nathan?
I do not. Thank you.
Okay, thanks. How about you, Doug Cross?
Hello. So we've gotten a report into our office from someone in the Muskoka community who is in a large apartment building. Someone's returned from the U.S.
not self-isolating, coming and going, shopping, etc. A lot of people concerned. Police were called several times, and reportedly the response was, "What do you want us to do about it?" Well, what does someone who is concerned about examination, etc., what's the best course of action? Is it the police? Is it contacting your office to give the information? Because I think they're feeling a little frustrated in a building of 50 people that someone may be walking around and not abiding by the regulations.
Well, thank you very much for that. Clearly, I would be very concerned about that, and I would want enforcement to happen. It does fall under the Federal Quarantine Act, which speaks to something called peace officers to enforce the legislation. And our understanding is that does include police, and it does not include public health. We are actually empowered to enforce the provincial directives that have been issued with regards to the closure of non-essential work environments, including sit-down restaurant locations. And we are prepared to work with the police and between us enforce, and as we would sort out between them. What I would suggest is people could certainly call us, and we would certainly follow up with the police and work out how enforcement would happen. And I do appreciate you letting me know about the experience that you've had as well. We are reaching out to police at this time, various police departments throughout Simcoe, Muskoka, to work out an understanding about this.
I see. So, and if someone's calling your office, are we still looking at long wait times sort of as an impediment to that?
It's much better than it was. The volume of calls has fallen quite substantially. So I would anticipate that you would have a much better time of it than you would have, say, 2 weeks ago, a week ago.
Tremendous. Thank you.
You're welcome.
Okay, how about Dawn Huddlestone?
Hi, thank you. My question relates to the OPP as well, but from a first responder type perspective, we have, we've talked a lot about personal protective equipment for healthcare workers, but do you have any information on what's happening with police officers in particular? Because they're often coming into close contact. So are there measures being taken for them to either not transmit infections to people or to prevent getting infected themselves?
So I don't have as good a handle on that myself. So that is something I need to look into. What I would recommend for them is that they do the social distancing. Of course, that's going to be a limited ability for them to do. I do know that ambulance attendants are very well equipped with personal protective equipment, including N95 masks. But it's not clear to me about the police or the fire department. I do believe from some communications I've had that they do keep on hand masks, surgical masks. And I would be recommending at this time that if they're coming within 2 meters of someone as part of their work, it probably is a good idea for them to be using that. Because after the fact, they don't know what kind of exposure they would have had or if the individual in question was carrying COVID or not. And we just got a directive from the province indicating that for, the operators for first responders are able to obtain the test results on individuals that they've come in contact with through their work in order to find out whether or not they'd had an exposure. So that is something new for them, to get information to determine whether or not they've had an exposure.
Okay, thank you. And I just have a quick question. Are you aware if testing is still, if the testing backlog has still remained caught up, or if that's, if they're seeing greater volumes once again?
So from a teleconference that I attended this morning, which included a laboratory report, they are indeed still caught up.
Wonderful, thank you.
You're welcome.
Okay, Erica Engel.
Yes,
I just need to clarify the numbers. So you have 87 cases listed on the website. Yesterday you said there were another 11 not posted, which brings the total to 98. And then you said 6 more cases this morning. So is it 104 or 105?
So what? Okay, what else? Let's stick with what I got in front of me here. So what you have up on our website right now needs to be updated. When it's finished, you'll have a total of 99 listed. And there'll be another 6 that we weren't able to get up today, or won't be able to get up today because they came in after 5 o'clock yesterday and need to be investigated. So therefore the total is 105.
Okay. Could you run through the locations of the up to 99, like from your website has 87, so from 87 to 99?
So number 87, New Tecumseth, 88, New Tecumseth, 89, New Tecumseth, 90, Gravenhurst. I see that I made an error. Earlier I said there was only 1 from Muskoka. There's actually 2 from Muskoka. So 2 from Gravenhurst, I apologize. 90, Bradford, West Gwillimbury, 91, Bradford, West Gwillimbury, 92, Bradford, 93, Bradford, 94, Bradford, 95, Bradford, 96, Penetanguishene, 97, Midland, 98, Gravenhurst, and 99, Bradford.
And do you have a follow-up, Erica?
I do. I actually spoke with someone this morning in Collingwood who has confirmed positive for COVID, and he actually said he believes he got it from speaking to a person who had actually recovered, and that they were practicing physical distancing while they were speaking. So he's sort of concerned that people might not understand that even if you're practicing physical distancing, there's still a risk you could transmit. Just wondered if you wanted to comment on that. People are thinking, maybe I can go for a walk as long as I stay far apart from the person I'm walking with. Maybe you want to be a little more specific on that?
So, of course, people always have their suspicions about how they got something if they don't know for sure. We do know from the best of our research that 2 meters distance is highly protective. It won't be perfect, but it's highly protective. We do know that a full recovery, 14 days, is highly protective as well, though not absolutely perfect. There can be the very occasional individual that continues to shed virus after that time. It's not clear even then whether or not they're infectious because the levels are very low when they continue to do that. That is, by the way, one of the reasons why we have healthcare workers be tested after they've recovered to have a negative test, 2 negative tests before they go back to work. We also know that there's community transmission happening right now. There are people who are asymptomatic who can be transmitting, and it's entirely possible that in this case of transmission that you're referring to, this individual got it from somebody else who simply didn't have symptoms or wasn't apparent to them, and thus they had their exposure and got their infection. We'll never know for sure. That person will never know for sure. It really goes back to the importance of practicing the social distancing to the utmost.
I just meant, further to that, what about people who think, well, I want to go for a walk or have drive lizards with my neighbor as long as we're 2 meters apart? Is it safe?
So far I'm still saying people can go for a walk. I am aware that the Premier has been saying people should not go out at all. But that is not regulation as yet. It may come to that, but it's not regulation as yet. So I'm still saying that it's important for people to get exercise, and it's important for their mental health as well. But when they do so, they need to give distance to other people. It needs to be 2 meters or more. And if they have an encounter with a neighbor, they need to maintain that 2-meter distance or more. And I think it's wise for people to limit the number of times they go out. If you're going to do this, do it once. Don't do it multiple times. If you need to shop, why don't you plan so that you only have to do it once a week? I think shopping in some ways would be higher risk because you're going into a building with many other people, and you can do your best to maintain distance, but there's still the potential for, with more people in there, to have an encounter. And there are surfaces that you're going to be touching. You'll need to be washing your hands. So caution about the number of times you go shopping or go into a premise somewhere. I think outdoors you're probably safer, but even so, you want to limit the number of times that you go out in a day.
Okay. Chris Simon?
Yeah, thank you. Dr. Garner, can you just confirm the number of cases at the Bradford Valley long-term care facility? I'm just a bit confused. It's so 16, 14 residents and 2 staff. Is that correct?
We have 14 residents testing positive to date. 5 of them were in the last... Let me just make sure I've got this right for you. 5 of them, say, one for the... Okay, 14 residents in the past, in total, and 2 staff in total. So this is what you got in total. I think earlier I said there were 5 residents that are new. I apologize. 4 new residents and 1 staff that are new. So 5 individuals, 4 of them are residents and 1 is a staff.
Okay, so 16 in total, 14 residents, 2 staff.
That's right.
Okay, wonderful. Just wanted to make sure. And were you able to identify the cause of the outbreak in Bradford yet? I know you were saying yesterday you suspected that it would be staff related, but were you able to confirm that?
I'm highly suspicious that it is. That is how these things happen. We do have a staff member who is a case to begin with. We have an additional staff member under investigation right now. Staff are the ones who come into these facilities. We don't have visitors coming in. It is the way in which these things are now happening.
Okay, thank you. Is there anyone on the call that came on late that we missed? Sorry? Sorry, who is this?
Mike from CTV.
Oh, hi, Mike. Go ahead, please.
Yeah, Doctor, just if we can go by that table 2 that's on the website, how many cases have recovered since yesterday?
So that information I don't have at my disposal right now.
Are we going to have that by end of day?
No, tomorrow is when I would get back to you.
Community transmission, has that ramped up?
So just to be clear, we've had 2 individuals who've recovered while hospitalized. And in total, we've had 29 individuals who've recovered. But I don't have any information about specific cases or which ones recovered in the last 24 hours. I don't have that information.
But of the 105, 29 recovered.
I'm sorry, could you say that again?
Of the 105, 29 recovered is the most up-to-date we have?
Yeah, that's what we have.
Okay, and hospitalizations remains at 5?
We've had 5 deaths. We've had
5 deaths.
We've had a total of 21 hospitalizations.
Okay. What's your message to the public right now? Are you pleased with what you're seeing?
No, I'm concerned with what I'm seeing. We're continuing to have cases. We've had a substantial number of cases even in the last 24 hours. There's evidence of community-wide transmission. and people need to be exercising the social distancing precautions. We are expecting this to continue to rise through perhaps the month of April. Our task at hand is to do all we can together to flatten the curve, reduce community transmission. We still expect that rise to continue, at least to some degree. Our goal is to flatten it so that it doesn't overwhelm the healthcare system, but I'd say I remain concerned.
Thank you.
Okay,
You're
thank you.
welcome.
Anybody else who might be on the line? All right. Well, in that case, that concludes today's media briefing. Thank you very much for joining us, and we will see you tomorrow.
Thank you.
Thank you. Goodbye.
Thank you.
Really great. She sent him down to the home economics room to have the tear in his pants repaired by the girls.
Classics Club is all about the conference in May. Definitely what we work towards for the entire year is the Classics Club conference. But it's a chance to really show what you're passionate about and show your strengths. There's everything from athletic competitions, academic competitions, to creative competitions where you can take an ancient myth and then alter it into sort of pulp culture references and changing it around so people can understand it. There's fashion shows, so if you want to design and learn more about fashion, you get that chance. You get to have someone like Miss Gillis actually kind of guide you on your way to learning how to design clothes and makeup and everything else. It's really a great experience to learn whatever you want to learn.
I remember I was in band and classics, and they were both on Thursday nights, so I would just stay at school for up to sometimes 14 hours, just from 8 in the morning until about 10 at night. And you'd come to school, after school you'd go to classics, you'd break for dinner for about half an hour, band was at 6:30, and then after band you'd come back and keep working in the Latin room until the janitors kicked us out.
I was always fascinated by languages and also by history and the poetry in Latin by Catullus and Horace. I remember it fondly, but I could not quote for you. And also living in Europe and traveling around, I found out I was in the same places that Caesar had written some of his letters, and some of which we even translated in Mrs. Stewart's class. Carpe diem, which Mrs. Stewart always told us meant, gather ye rosebuds while ye may, from Horace. And also nowadays, people just say, seize the day.
I went on the Greece trip in 2012, which was the last, I think, classics trip to Greece that Gilly, the Latin teacher, did. Very small group of us, only 15 of us, but fantastic trip. Beautiful, beautiful country. We got to spend a day in Paris too, and I don't know, it's just the people we were with, I guess, just kind of central spirit, I guess. I don't know. You kind of get to know everybody on a trip like that. It was great. It's awesome.
We were always huge with school spirit. In fact, the Classics Club, we actually had an award named after us at conference. They called it the Phoenix, or we got to name it. We called it the Phoenix. And they created the Spirit Award just for us because we were just so excited and cheered for everyone, and always had the paint. We did face paint. We did paint in my hair. One year it took like 2 weeks to come out. It was lots of fun.
There are a couple of schools have Gaelic mottos. There are a couple of schools who have Greek mottos, but most schools do have Latin mottos, and the Latin motto for Barrie Central is Labor Omnia Vincit, which means work conquers all, and it's taken from the Roman poet Virgil.
At our graduation ball, they named some of the dances after the people that were graduating, and mine was called Waltz Waltz.
It's a place filled with history. To me, it has so much history from everyone who's grown up in Barrie. They know about Central. They know about the plays that have been happening at the Fisher Auditorium. At one time, it was the only auditorium in Barrie. Now I think it's only Allendale that has one. So it's going to be a shame to kind of lose that, and it's going to be a shame that my children will be able to grow up and walk down the same halls that I did.
I almost became a Latin teacher, but I got a job as a French teacher instead, and certainly I got my start here.
I remember noon hour basketball. That was good. I can remember playing hooky to go to Midland to watch one of the football games. Got expelled for a few days. That was Mr. Bowman was the principal then. You know, I remember the shop, the making stuff in the woodworking shop.
Well, what's really special to me about Barrie Central is the band. And I am just so thankful to have had the band with WA in my life. And I think it really formed the foundation of my life, and not just the love of music, but the love of learning, the love of travel, the love of new things and meeting other people. And it certainly gave me a good basis for raising my own children, who all went into the musical area as well.
Well, being in the band was very special. You know, we were together a lot for trips and for rehearsals, and it was just really nice to learn an instrument and make music. I guess the most memorable one would have been Ravenhurst, the year the Queen visited. We were playing out on a barge and the Queen attended. She was here that year. When we went to some private boys' school one time, a lot of cute guys there.
But I remember being with a group of friends of mine, and one of them asked for a quarter, and we actually threw it to them down the hallway to the other end of the hall, and it actually landed in their back pocket.
In the United States, because that's where I live, they have reunions all the time, 5-year, 10-year, 15, 20. And they doesn't mean that much because the schools are so big. They don't have the same kind of connection, the same kind of camaraderie that we had when we were in school, because we went to school with a lot of the same kids from elementary school all the way through high school.
They had a room that was all full of uniforms, and you would get uniforms every year, and you would practice. You know how they march and that sort of thing. We'd go out into the, I guess it's Red Story Field now, and you'd go out there and they would practice, or we would practice. And then there was every year there was a parade, and we started up at the old City Hall and came down Dunlop Street and ended up in the arena. It was that close to after the Second World War, I guess, that those things were still pretty important.
Hey, I started here in '74, and one of the main prestigious things you could have is a Central leather football jacket. I used to have kids, they didn't want to be in my math class, but they stayed in school and went to school because they're going to get this jacket. And for a lot of them, it's a highlight. Forever just meant excellence. I mean, that was the time where we basically dominated football all the way, close, and we could take on Toronto teams. But again, the pride was the main thing, and I always run into former students as that, and boy, if it fits, they're still wearing them.
And in my last year, 58, 59, me and a buddy of myself did some of the lighting on the musical that year, which was called Kittiwake Island. And that's one of the things I remember because it was right up in the newspaper about it. We had a moon that had to come up behind the backdrop on that, and we had a light that we just sort of brought down, and boom, it was there. And they made a comment about the moon coming up faster than Polaris or satellite or something like that in the local newspaper at the time.
Not only in my time period, but I mean, my sister, my brother, and I went here. I have my best friend that went here. We've been friends for well over 20 years now. My daughter is going here. She's actually in the final graduated class this year. My niece and nephew have gone here. My nephew is playing rugby, which they just won the semifinals for their rugby. So it's now almost become a family legacy, but that has actually ended this year. But It's not only my years that have held special meaning, but with my daughter, she's played basketball now, so she carried on the family tradition, and so she's going to go on to play in future. So it's special.
Oh, and the dances. Oh, I loved to dance. We had Teen Club, Teen Town in the gym.
I was on the gym team in basketball and football. We beat North one year, 14-0. That was junior football.
I think one of the most important games I remember about Central was playing against Innisdale. And they came to our field out there and did a mockery of it. And they came here the very next day and they found out what Central's all about. We pounded them and we sent them home on their bus. And they never did that again. So that's what I mean about this hall.
Played North here in our good year, and we lost the first game. We played them in the playoffs and beat them up in their park. So that was a good time.
I was just commenting that when I started here, we had shooting practice in the gym. Can you imagine bringing guns into the high school now?
I was in the camera club, and I remember developing pictures down in the basement that we can't get to now.
This year we went to GB's and we did a lot of hard work, and we went to GB's and actually won it this year, and our goal was to go with like a big bang.
I met the girl that would be my wife, and we've been married 55 years this fall, and we've raised 4 wonderful sons, and we have 6 granddaughters.
The 3 of us that chummed around together, and in my first year of grade 13, after the first part of the year, they reorganized our seating, so I got moved to the back of the class, so some of the other students got to the front. Anyways, at one time we were coming in at the beginning of a class, and the teacher, Mr. Mitchell, asked me a question. I was too busy talking to some of my buddies and that sort of thing. So he said to the guy that was my buddy that sat in front of me, he said, "Kick that guy, will you?" And my buddy kicked the guy in front of him instead of me, which was behind him. So whenever I think of that, I get a kick out of it too, because obviously he wasn't really paying attention to what was going on either. So,
well, we had a 6-year club that was, because you used to go to grade 13 was the 5th year. Okay, but if you couldn't get everything, well, then you had to come back the next year, and so I was in the 6-year club.
I was the main gymnastic coach here for years, but I also coached volleyball, and I did a little track now and again. I looked after the Barrie Central Athletic Association and all the coaches. Our gymnastic team went to many GBSSAs, and we won quite a few. We also went to OFSA quite a few years. I remember 2 of our students in particular that did well.
Irene Nikowski, I just told her she made me a better person. She was a coach of mine for many years. She taught me phys ed for many years. And she just exudes integrity for me and represented strength and character, and I admire her for a long time.
I was coaching, I think it was a junior volleyball team. We were playing in Stainer, and my team was down 14-0. And I remember I threw a timeout, called them over, and all I said to them was, "The score is 14-0, you figure it out." They went back and won that game and won the second game. So they did a marvelous job.
But I had never seen staff so friendly as at Central. And all these teachers are so helpful in helping you in doing things. Not only that, the kids, they're really good there. They pick up things for you, and they respect who you are.
It was really interesting to be able, at Remembrance Day ceremonies, to listen to the roll calls of people that had gone to this school, that had fought in the wars, and having that kind of history behind the school is something that not a lot of people have that opportunity to experience, and it was really cool to have that.
My father and my mother both attended Barrie Central, Barrie Collegiate at that point. They fell in love through a church choir and got married. And when I was 2.5 years old, and my brother and sister, who are twins, were 2.5 months old, my father left to go off to war. And he didn't come back. He was killed in the war in Italy, in the Liri Valley, near Monte Cassino. And was when I came to Barrie Collegiate, the pictures of the men who'd been killed in the war were all on the wall, on the main wall facing the principal's office. And every Remembrance Day, there was a Remembrance Day ceremony, and I would usually be called upon to read the names of the people who had fallen in the war. And I'd go along, and it happened several times while I was here, and coming to the name was always kind of interesting to think of what had happened to him and then what had happened to me as well.
I was on the cheerleading team with my sister before she graduated, and it just carried on. I was on the team for 3 years, cheering on the football team. The spirit here was unreal. It was amazing. We all were really proud to be a Redskin. There was one time I got tackled by the football team coming down the sidelines. It was a little uncomfortable at the time, for sure.
My good friend Rob was Captain Central, and he used to run around in his long johns and a big cape at all the football games, and that was good times.
Mr. Mitchell was my favorite teacher, and in grade 13 he said to me, "Gordon, what are you going to do with your life?" And I said, "I don't know, sir." And he said, I suggested you become a civil engineer." I became a civil engineer, primarily because of him.
The band, I went to Austria and Germany back in 2009, and it was just a great experience to get to go. We performed at schools over there, so it was nice to get to see like students from other parts of the world and things like that. So it's probably my favorite memory from Central. We're 4 siblings, and all 4 of us went here. My younger brother is going to be a part of the last graduating class of 2016.
I remember like yesterday the hockey series in 1972 when there was no classes. Every teacher had a brother TV in, and I'm sure I was in the cafeteria to watch Paul Anderson score the winning goal. Tech shop, I remember we called Mr. Parker, it was actually Brother Parker. Everybody was a brother.
Really just playing basketball. I played all 4 years that I came here. Mr. Creville was one of my favorite coaches. Recently passed away, but he was a really special coach. He really inspired us to do our best and pushed us to always succeed, not only on the court but off the court. So he was one of those coaches that it will stick out forever in my memory about Mr. Creville being my coach. The team is always part of it, so it's not only you doing your best, it's having your team do the best around you as well. So that always would stand out for me throughout my entire life. Even now in my own job, the team has to succeed before you do.
And I think that's what we learned, is to be an expert in your field. No matter what you do, be really good at it.
This is where Joanne became famous. She was the Mother Abbess, and the sound of music, and made my life as a teacher a total joy. I will remember always people like you, because it really was. This was
well, that's what we've been saying
career.
This whole time. Is like this is a relationship between students and teachers. Is that it was a camaraderie. It was like such a shared event. Like we genuinely had great, respect and affection for each other, and we worked hard for you, and the teachers gave us 1,000% for us as well. So it was such a joy.
I enjoyed mostly the extracurricular was one of the things I totally enjoyed, and I got to be the drama coach and the coach for the musicals, and I had a chance then to meet people like Joanne, who really you get out of the relationship of the teacher student in the classroom, and you become friends. You really do.
And I used to chum around with a girl from Camp Borden, Doreen Reed, and we passed notes, her and I together, and he happened to see her get a note and want to know who it's from, and she said, "Oh, it's from Smitty." "Oh, I want to meet this guy," he said. And she said, "It's not a guy, it's a girl." "Well, I still want to meet this person." So we met in March of '51 down at the old Zuller's store. His name was Ron Smith, and in 1955 we were married.
We used to have to run around doing laps through the school, and you would go up the set of stairs across the floor in the first floor level of that old part of the school, and the floor would actually vibrate. High school was great. It was a very exciting time. I went to high school in the 60s, basically, 60s to 70s, and there was a lot of changes happening. We were allowed to wear blue jeans to school, and we had hairstyles changed and got longer, and it was an entirely different perspective, and the rock of the city, basically. How can you ignore the importance it's provided so many community leaders in all avenues, whether it's sports or music or academics or politics. The list goes on and on of people who've come out of these halls has moved on to big things and great things in the community and the world.
I think it changed a lot of people's lives and got people off on the right foot for a really long time, and it's sad it's going.
It's kind of funny because when you see it now, you don't really realize, but back then, this was like proving grounds. And it still kind of feels that way.
It's a reminder of life is ever changing, and that nothing ever is taken, we take things for granted, but that you can't always rely on what always was to be there the next time. So it's been, it's very sentimental. A colleague friend of mine has called me semi-mental, and I think that's a good summary as well of, it's just, it's a heartstring time for sure, and it's becoming difficult to put it into words because it just seems like it just can't happen.
Now, I hate these new cars. I got in mine today, and I couldn't figure out what to do. I couldn't find the accelerator, the steering wheel, even the radio, nothing.
Oh, they're very different these days.
Oh, no problem. It turned out that I got in the back seat by accident.
Oh.
And I know you're afraid of falling flat, and I know those walls are up against your back, and I know there are those who'd see a crack, but I know that you're stronger than that.
And have 6 wonderful children who are graduates of this school and who will, just as I today mention my father's early days in BCI, will reminisce about their days. The school will not die.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV. Barry.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
After a night out with your friends, there's always options for getting home safely. You could call your BFF, your mom or dad, whoever you can count on for a safe ride home. You could call your favorite cab company or 1-888 taxi guy. Or you could use the Arrive Alive smartphone app to help you choose your ride. Be it a friend, transit, or taxi, getting home safely is app easy. Now available for iOS and Android devices. Visit arrivealive.org to find out more. Arrive Alive. Drive sober.
This is Rogers TV.